I'm thrilled to introduce Dr. Arnaud Gagnel, who is professor of the Faculty of Medicine and Health Sciences at the University of Sherbrooke and has developed and validated the concept of promoting vaccination in maternity wards to parents using motivational interviewing techniques, dubbed the PromoVac strategy. I'll now pass it to him for his presentation on the use of motivational interviewing when discussing with vaccine-hesitant parents lessons learned from the Quebec PromoVac project. Thank you so much.
First of all, I have no conflict of interest to declare. And first of all, if you could think of what could you reply if you meet somebody, an ambivalent person about the COVID vaccine, and it's tell you, oh, there's nothing reassuring about what I have read on the internet about the vaccine. I'm not against the vaccine, but I read the very, very bad things and I very trust the vaccine. So just take a few seconds to think in your mind what you will spontaneously respond to this person. And we could see at the end of my talk if you have the same answer. So now, what are there is a lot of problem with vaccine hesitancy, and one of the most important problem in vaccine hesitancy is what I've called the information paradox. When you look at the literature about what we could do with vaccine hesitancy, and you could see when we use a traditional educational approach, and when we give more information, more facts, and trying to give more education to people, it doesn't work, and very often it could backfire and reinforce vaccine hesitancy. But on the other side, when you ask parents, what do you need to take your decision about immunization? The answer of the parents is, we want to have more information. So what's wrong? You have the literature that's saying to give more information doesn't work. And when we ask parents, they want more information. But parents want information, but they want balanced information about vaccination benefits and harms. They want also information presented clearly and simply, information tailored to the situation and information in a good time. So maybe the problem is not, should we give some information to parents, but what information should we give to parents, and how should we give those information to parents? And we're going to see how a motivational interviewing approach could help us to meet parents' needs or people needs to give some information about immunization. The second problem is it is us as a healthcare providers, because we very often want to resolve our patient problem, and it's called the righting reflex. So we want to correct our patient and we want to tell him what he should do. But what's happened when you have some people who are very hesitant, very often, sorry. Okay. If a people is very hesitant, if we tell him what he should do, when you didn't listen him, when he thinks that their freedom is threatened, your relationship with your patient could become a struggle. So it is very important not trying to correct this information at the beginning of an intervention that we're going to see after at the end of the presentation in the video. What's happened also with the level of vaccine hesitancy? There is different hesitant people. No, there is a continuum on the vaccine acceptance, and so every hesitant people is different. So you could have very, very hesitant people who refuse all the vaccine. On the other side, you could have some people who accept all the vaccine, and in the middle, you could have very lot of variation of hesitation. People that are not sure they want to receive the vaccine. People think they want to receive the vaccine, but there are some fears. Or on the other side, some people who doesn't want to receive the vaccine, but maybe they could be open to listen to you. So you should adapt the goal of your intervention according to this level of hesitation. And the more the patient is allowed to receive the vaccine, the more you can move towards the planification of the vaccination. But the more the patient is hesitant, the goal of your intervention could only be to have an open discussion about immunization with him, but not to planify to receive the vaccines. It's also important to follow the ability of change of the people when you are faced with some hesitant patient. And what allows people to change, there is two things. It's his confidence of his own ability to change, the priority that he finds to change, and also the importance that he gives to the thing he must change. And according to immunization, to reinforce the importance of the vaccination of immunization to the people in one of the main pillars that going to lead to a change towards a more positive position for immunization. Also, it's very important to know that the change is a step-by-step process, and you couldn't change in one step when you are very hesitant about immunization. So, according to your intervention, we should move very slowly with those people to a more open position about immunization and not want to go directly to move toward a vaccination decision. It's going to lead to a great resistance. And so it's going to lead to counter-argumentation, and you will not be able to establish a trustful relationship if you want the people to move too fast toward a decision of vaccination. Also, there is lots of determinant of the hesitation of the patient. So why are the patients hesitant? There is lots of causes of hesitation. I just summarize the more frequent cause of hesitation, but we should know that it's at a global level, it's at the population level. But when we are faced with someone, you are not facing with the global population. We are faced with these people. And for example, for these people, he have his own determinant of his own hesitation for vaccine. So if you give lots of information, for example, according to the vulnerability of the disease, it doesn't work for these people, because for these people, his problem is the distrust in public health authorities. So if you don't address this problem for these people, it couldn't work. And accordingly, if you have another people and its problem, it's the vulnerability of the disease, you could share some information about the disease with these people, but it doesn't work, for example, with people A. So as healthcare providers, we have a lot of challenges when we face with hesitant patients, hesitant parents. So we have seen that given more and more information in a directive way, it doesn't work and it could generate resistance. So we should adapt to the specific needs of the patient, and in order to help him to support his own decision to vaccinate. So we should adapt the goal of our intervention accordingly to the patient level of hesitation. We should also adapt to the patient's ability of change to avoid resistance. If you are going too fast, we are going to develop resistance. And so we are going to lose a trustful relationship with the patient. That is very important to establish at the beginning of our intervention. And also we should find which information will be relevant for this specific patient and will reinforce his perception of the importance of vaccination. So the question is now is it possible to do that? And it seems to be very difficult. So first thing is to be aware that one single intervention, one single style of conversation couldn't fit every time all these needs. So there is not one single magic intervention that could be very successfully for all hesitant parents. So we should adapt to every hesitant people, and it's a very hard work. So, and we're going to see how motivational interviewing could help us to meet those needs. So motivational interviewing at the beginning was developed by Miller and Wolnick. They were psychologists, and they developed a motivational interviewing strategy and approach 30 years ago with patients with addiction. And they have seen to tell some people who take drugs or tobacco, you should not do that. It's no good for you. It's no good for your family. It doesn't work. And on the contrary, if you try to not judge them, and if you try to establish a partnership and to help them with empathy to solve their ambivalence and to help them to move. Sorry, I have some. If you help them to move towards a more positive position for change and to find themselves their own reason to motivate for change, it works better. And motivational interviewing is based on a spirit of partnership, of acceptance of the position of the people in a judgmental way. It uses some processes. First, you should engage into a trustful relationship and focus on what is the specific problem of the people before going to a change talk and before to go to planification for change. If you start with planification, it doesn't work. And it uses also some skills as open question, valorization, reflective listening, summaries, and a technique to give some information that it is elicit, share, elicit, and we are going to have an example at the end of the talk. So, sorry. We have tested motivational interviewing in immunization into the Promovac strategy. What is a Promovac strategy? It is an educational session given at birth to parents in maternity wards using a motivational interviewing approach in order to increase vaccine acceptance. And so we developed this strategy because we have seen that there is a failure of the traditional educational information strategy. And also, there is a need for early vaccination promotion strategy because the first vaccine is at 2 months. And we have seen that if there is delays in the first vaccine, it's associated with a delay all the vaccination schedule in childhood. And also nurseries could be a safe place and a good place for early vaccination strategy promotion because every birth at given in a maternity ward. So we test this strategy first in the regional cohort study in Sherbrooke in Eastern Township. And we have seen that after receive this educational intervention using a motivational interviewing approach, we're able to increase the proportion of parents that are tending to vaccinate their child by 15%. And when we follow this cohort of more than 1,000 of families, we have seen that if the parents receive the intervention in maternity wards, the infants during the 0 to 2 years periods have 10% more chance to receive a complete vaccination schedules without delay. So we also have conducted a randomized controlled trial in the province of Quebec on near than 3,000 families in the 4 main maternity wards hospitals in Quebec. And we have also demonstrated that we have still an increase of vaccine intention in parents globally by 12%. And we also measure the vaccine hesitancy score developed by Opel in United States a few years ago. And we could demonstrate that we have a decrease on the vaccine hesitancy score of parents by 40% when they receive the intervention. And what it is very interesting, it's when you look at the level of hesitancy with the vaccine hesitancy score of more than 50, it's a high level of vaccine hesitancy. Before the intervention, there is 15% of the population who have a high level of vaccine hesitancy. But after receiving the intervention, there are only 5% of parents who are still with a high level of hesitancy. So we were able to decrease by a factor of 3 the proportion of parents with a high level of hesitation. So accordingly to these good results, we established a partnership with the Ministry of Health in Quebec to implement the Promovac strategy into a provincial program. Sorry. This program is called EMI. EMI, it's a French acronym for Motivational Interviewing in Maternity Wards for Immunization of Children. And the philosophy of the program is to offer to all parents in Quebec during the stay in maternity wards an open exchange of vaccination to support the parental decision of vaccination of the child and to provide, of course, the best protection of the child and increase vaccination coverage in Quebec. So we evaluate the first year of this program. And you could see an example of a vaccination counselor. Sorry. You could see an example of a vaccination counselor at Sherbrooke. It's Mathieu, who gives the information session to parents in maternity wards. And so we evaluate this program for the first years on more than 6,000 families. And we find same results as in the previous ERCT, with a great impact of parental vaccination intention, with an global increase of more than 10%. We have a decrease of the parental vaccine hesitancy score of near than 30%. And so we are also able to have a great impact on parents with a high level of hesitancy. And according to vaccination coverage, we've also observed an increase of vaccination coverage in infants when parents were included in the ME program. So one more thing, it's we have a very high level of parental satisfaction with very few refusals. There is only 1.5% of parents who refuse to receive the program. And when parents receive the program, there is a very high level of satisfaction. Parents really appreciate participating in the program. They recommend that the programs should be offered to all parents in the provinces. And also, what is very important, according to the use of motivational interviewing, is that the parents are said that the discussion respects their point of view by 97%. And it's also for parents, it's a good time to receive intervention because lots of people think that maternity wards should be not the good place to do the intervention because the mother are very tired, etc. But when you ask parents, for them, it's a good time to receive this intervention. So now this program is implemented in all maternity wards in Quebec. There is 200 vaccination counselors in place that making those interventions. So what could allow this program is a one-to-one intervention could have a public health impact, a global impact of the population. When you look at this program, it reaches every year all the parents that give birth in this year. So it's 2% of the Quebec population. So in 10 years, the program could reach 20% of the population, and in 10 years, the program could reach mainly all the parents in Quebec. So accordingly to the book of Michael Gladwell, the tipping point is it will be a sufficient critical mass population to change vaccination perception in Quebec. Could we induce herd immunity about vaccination perception and inoculate parents against basic formation? And according to Michael Gladwell, if 11% of the population change, it could make a change in the global population. So now I speak a lot, but it's more interesting to see how it works. So I propose you to share the beginning of an intervention for vaccination counselor in maternity wards. with the use of motivational interviewing. For the context, the parents of Loic don't want to vaccinate him before the age of 2. And so we are going to look at the first 3 minutes of the intervention. And after we could have some conclusion about what we have seen in the video. So I'm going to stop sharing my screen. It's okay. And we could look at the first 3 minutes of the intervention.
Bon, bonjour maman, bonjour papa,
Bonjour.
Merci beaucoup de m'accueillir. Hein. Donc, je suis Arnaud, donc je suis conseiller en vaccination. Puis mon rôle, un petit peu là, c'est d'avoir une discussion sur la vaccination avec vous, puis de répondre à vos questions. Je suis avant tout là pour répondre à vos questions. Et donc, je vais commencer par une première question. D'ailleurs, vous en pensez quoi de la vaccination? Est-ce que vous avez envisagé la vaccination de Loïc? C'est quoi votre position par rapport à la vaccination?
Ben oui, j'ai envisagé la vaccination. Ouais. Je trouve que la vaccination se fait trop jeune.
Ouais.
Mais sinon, je viens de faire vacciner mon fils de 2 ans.
D'accord, ok.
C'est ça.
D'accord, donc ce que je comprends là, c'est ça, que vous pensez que la vaccination c'est important,
ouais.
Mais peut-être une crainte par rapport à quel âge on fait la vaccination. Ouais. Est-ce qu'il faut vraiment faire la vaccination à cet âge-là ou à quel âge on doit la faire? D'accord, on pourra l'aborder si vous voulez, hein, c'est bien important. Donc vous avez envisagé de vacciner Loïc, mais un peu plus tard, si je comprends bien, c'est ça? Bon, parfait. Est-ce que dans la vaccination, vous avez certaines questions par rapport à c'est quoi la maladie contre lesquelles on protège? C'est quoi les vaccins qu'on donne? Est-ce que vous avez des questions spécifiques un petit peu?
Ben, les vaccins en soi ne me dérangent pas. Ouais. C'est vraiment l'âge à laquelle on les donne.
D'accord. Donc c'est vraiment...
Parce que je les ai toutes données à... je viens juste de les faire. C'est vraiment... D'accord. Okay. Ça fait 1 mois que je les ai faites. Là.
Ouais.
OK.
C'est une question aussi d'anticorps que l'enfant il est jeune, les anticorps ne sont pas tous développés.
D'accord.
C'est une crainte qu'on nous autres on a.
Ouais.
OK, parfait.
J'envoie pas mes enfants en garderie.
Ouais.
Donc ils restent pas mal chez nous.
Ouais.
Puis j'allaite jusqu'à 18 mois.
D'accord.
Fait que tu sais...
Ok, donc à ce moment-là, vous pensez qu'ils sont moins susceptibles d'avoir des maladies parce que comme ils sont à la maison, puis vous allaitez, ça les protège aussi, c'est ça?
Oui.
D'accord. Donc c'est vrai que vous avez raison, parce que le mode de vie, l'exposition aux maladies change en fonction du mode de vie aussi, bien sûr. Hein, c'est vrai que la garderie les expose à beaucoup plus de maladies. Et puis l'allaitement, on sait que ça protège aussi, et ça donne des anticorps de la maman aussi au bébé. Hein, donc tout ça, c'est des bonnes stratégies pour protéger les bébés. Donc à ce moment-là, est-ce que ça vous intéresse un petit peu qu'on parle un petit peu, parce que vous parlez d'anticorps, de voir un peu comment ça fonctionne un vaccin, comment ça fonctionne l'immunité, comment ça fonctionne un vaccin. Ouais. On va peut-être commencer par ça, puis comme ça on verra un petit peu pourquoi on vaccine. Alors qu'est-ce que vous avez compris du fonctionnement d'un vaccin? Qu'est-ce que vous papa me parler d'anticorps? Qu'est-ce que vous avez compris un peu de...
Moi, je pense qu'il injecte le médicament sans le noyau. Ouais. Pas le médicament, la bactérie sans le noyau.
Ouais.
Puis là, ton corps crée des anticorps face à...
Ouais. Ah, c'est bien. Ouais.
C'est ça que j'ai compris.
Ouais, c'est ça. Est-ce que vous connaissez le terme d'antigène? Moi, d'accord. On connaît l'anticorps, d'accord. Bon, c'est ça, donc vous avez raison. Hein, donc il y a des microbes.
Okay, so I'm going to share my screen now. Okay. Okay, so after this example, the video, I just want to share with you briefly a summary of what motivational interviewing could allow us. If you are seen in the video at the beginning of the intervention, the main goal of the vaccination counselor is to establish a trustful relationship with the parents. So it's to be not judgmental, just to accept the hesitation, to be curious about what are their beliefs, what are their position, not trying to correct misinformation at first, as you have seen that I didn't correct the misinformation at the beginning, that there is no antibodies before the age of 2, that is no good to vaccinate before 2. You just want to let people express their fears, their concern, and not trying to convince them with more argument. It's very important to express empathy. It's to show people that you want to understand them and you want to help them. And empathy is the most effective way to move toward a change. And when you have established this trustful relationship, it's also important to try to understand what are the specific determinants of the person hesitation. So in this case, ask why people don't want to vaccinate before the age of 2. I use, as you could see, open question. Also use complex reflex. It's okay, so if I well understand, you think the vaccination is important, but you have some concern about to vaccinate before the age of 2. Yes, it's like, okay, if you think that when you give you breastfeed your child until 2 years, you will protect him from disease. Okay. And also it's important to target what will be the relevant information to provide to this specific person to increase the perception of the importance of vaccination. And in this case, for these parents, it's to understand why vaccination it's a good way to protect before the age of 2. So during the intervention, we spend a lot of time trying to explain the development of the immune system, how it works, and how was the immune system at birth for the baby. Also, it's very important to offer the information that is relevant to the person, but to offer the information at the right time. So the right time is not at the beginning of the intervention. You could only offer some information only when you have established a trustful relationship, you have listened to the parents, you have understand what are the specific determinants of hesitation for the specific parents, and only at this time you could select which information will be relevant for this person. And before to give the information, you always should ask permission before giving information. And also it's very important to arouse curiosity. So if you are seen in this example, don't starting to explain the development of your immune system to parents. I ask them, do you want to see how the immune system works? What do you know about the immune system? And in this way, we could have together a co-building of new knowledge in a partnership that will increase the perception of the importance of vaccination. And last thing, very important, is to respect the autonomy of the person. It's very important that the person feel free to take their own decision, and you are only here to try to help him, but not to tell him what he should do. So if you want to read these articles by Eric Budman in Stat News, Eric Budman is a journalist from the Boston Globe that spent 2 days in our maternity wards to see vaccination counselor, to meet parents, and he also meets Mary-Hélène, the mother of Toby. Mary-Hélène was an anti-vax mother, and we have a long discussion about immunization. And at the end of the discussion, she decided to vaccinate a child, and you could read in this very good paper how it works and what motivational interviewing could allow us. I think I have just a couple of slides to thank you so much to every people involved in the PromoVac study, in the ME program, and also to French philosophers that have thinking about the principle of motivational interviewing 400 years ago, and so motivational interviewing is not so new. And just to end it, think about what will you respond now when you face with people who is hesitant about COVID vaccine, and do you have the same answer at the beginning of my presentation? So thank you so much for your attention.